Hi everyone, this is Nilanjana coming to you with a video on weight loss injections. So these injections are all the rage all over the world, especially here in Australia. I see several patients every day asking for injections for weight loss. People are spending a great deal of money on these injections. But what are they really? How do they work and why do we want them? How do they work? So if, for example, you eat a breakfast of a toast and a boiled egg when you're not taking the injection, the stomach empties in about 4 hours. So 4 hours later, the stomach tells the brain that, okay, I'm empty, you can send out signals for hunger. Then the brain sends out signals for hunger and the stomach starts secreting the acids and the enzymes and all the digestive juices that it has to use to digest the food. When you're on the injections, the change is that instead of the stomach emptying in 4 hours, the stomach then empties in 8 hours or more. And because the stomach is full, the hunger signals are not coming from the brain. But the side effect of that is also nausea, because we're feeling full for a long time. But this nausea does not last very long. The body soon, in most cases, gets used to the chemical. And what was emptying in 4 hours now empties in 8 hours or more. The other common side effect, of course, is constipation, because the amount of food you eat and sometimes the type of food you eat has changed. So the body does not quite know what is going on, and this results in constipation. The other common side effect, as I have already mentioned, is nausea. Now, people take these injections for at least 6 to 8 months, and they usually will discuss with their doctor, this is what I want to do, this is my target weight. And with their doctor, they will have a discussion and have a target weight. Now, once they reach the target weight, the idea is to reduce the dose and gradually get them off the injection. The injections are not for life. Aside from the finances, there are other side effects that long-term injections will cause. Among these side effects, abnormal liver function tests, gallbladder problems, including gallstones, are very common. So if you already have a problem with your gallbladder, you have gallstones, or you have abnormal liver function tests, then I would tread very carefully before starting any of the injectables for weight loss. People look at this as the shortcut, but it is not a shortcut by any chance. These injections are just buying you time while you figure out what you can eat, what you cannot eat, and what kind of exercise and how often you need to do in order to lose the weight. Because while you're on the injection, yes, you will be losing weight, but once you come off the injections, you will have to depend on your lifestyle to maintain that healthy weight. So that's the important thing that I want to get across. The injections are expensive, they have side effects, you have to be very careful while you're on them, and they're not forever. So the injections are just a help. They're just a little bit of a crutch while we get our lifestyle in order. They are not going to be there for the rest of our lives. And if we try taking them for a long time, we might see certain side effects that are usually not there when we're taking it in the short term. If you have any questions, queries about the injections, please post the query down in the box and I'll try and answer your query. Thank you for listening. Bye.